Good day, everyone. So today we're going to tackle the basic counseling skills of a group counselor, because the effectiveness of a group counselor doesn't just rely on the expertise of the theoretical knowledge as well as the techniques, but also their capacity to apply these basic counseling skills. First, we have the active listening. So, in active listening, no, it involves giving our full attention as a counselor to what our client or the group members are saying, including observing their nonverbal cues such as posture, gestures, and tone. Because in active listening, we do not just listen, we also have to be fully present, no, with our client, so that we would know if there are incongruence with their verbal and non-verbal communication. So for example, no, if a member may say I'm fine, but the counselor notices their slouched body, no, and there might be trembling voice like a hilakon, which is an indicator, no, of a deeper distress. Second, we have reflecting. So, in reflecting, it conveys na the very essence of what the member has said, so they can better see and understand themselves. So the very purpose of reflecting, no, is to enhance self-awareness, no, that would somehow encourage them to share, no, in a deeper sense, especially with our personal experiences. So for example, a member will say, I feel like nothing's changing. So the leader will respond, you may you seem discouraged about the group not meeting your expectations. So take note of the word seem, or you sound, because that will convey a message that as a group counselor we are not conclusive with our statements, meaning we do not jump into conclusions, but there is that um, word that will signal them that we are somehow trying to point out an emotion that we have observed, but it is not definitive. It is not somehow labeling them that it's really what they are feeling. Third is clarifying. So it focuses no on key issues and will help the member sort out confusing thoughts and feelings. So there are times that our clients know that they are feeling two opposing emotions. So for example, a member will say, no, I love my dad but hate him too. So a leader will respond to it, like, for example, stating, you are experiencing both love and resentment, which feels contradictory and overwhelming. So in clarifying, we are able to somehow present to our client those opposing emotions, so that they'll be able to reflect that those negative emotions are not easy to handle, no? Like love and hate, especially with the significant others. Then we have the fourth counseling skill, which is summarizing. So it is about pulling together themes, key emotions, or repeated topics in a session. So the very purpose for us group counselor to summarize is for us to be able to provide clarity and direction for the group, especially if the member of the counseling group has already shared no much. For us to be redirected from time to time, we need to summarize so that we can follow through the story. So example, after several members share anxiety about relationships, the leader summarizes, no, for example, the group leader will say, it sounds like many of you are navigating trust issues, no? Or Um, it seems that most of you here are struggling establishing intimate relationship. So fifth is we have facilitating. So in facilitating, we are encouraging the group members not to be interacting with each other, openness and being supportive no among members. So in facilitating, it includes helping members express no their fears, and we also assure to um, establish an atmosphere of having a safe space for them to explore their emotions, to share their thoughts. And we also have, in facilitating, we also have to encourage them to engage in risk taking conversations. So when we say risk taking conversations, that is empowering them to somehow um, engage in challenging topics no that will invite members to share their thoughts, and also with that risk-taking conversations, we help them manage conflict and reducing dependency on the leader. The next that we have is we have empathizing. So when we empathize, take note here, no, there should be, in empathizing there is objectivity no. This is opposite of what we termed as sympathize, because in empathizing it's our ability to understand no, to put ourselves in the shoe of others no, and we understand and share the feelings of another person while we maintain no being objective. So the very purpose of empathizing is to validate no and connect to our client. So example here in empathizing, no, a group counselor might say it must feel exhausting, no, carrying that pain alone, no, for so long. So that is validating the feeling of our client that it's overwhelming to be carrying the baggage, no, especially emotional baggage, alone for quite some time. Then we have interpreting. So in interpreting, we offer tentative explanation for behaviors or patterns. So when we say tentative again, we present no, our um, interpretation of what they have shared in a form of a hunch, no, which would somehow encourage members to assess what they are um, hearing. Example here, no, the leader stated, Jeffrey, when a person in the group now talks about something painful, I have noticed that you usually intervene and become reassuring. Do you think that maybe your way of protecting yourself from feeling overwhelmed is to shift no, the um, way you approach the conversation um, into off topics no, topics that may not be related to what has been shared, or um, the group counselor might say to the client that I have noticed that whenever someone shares something painful no, a painful experience, you have the tendency to shift to giving advice. Do you think that they may be your way of protecting yourself from feeling overwhelmed? So those hunches that we present, we have to throw it back to our client for confirmation no, because again in counseling it's not all about us as a counselor, but it's all about the client, so we may have interpreted it differently from the context of our client. Okay, next we have questioning. So in counseling we should be able to use open-ended questions, that is to increase self-awareness and reflection. we refrain from asking questions that can be answerable by a yes or a no, because it will not give opportunities for our clients to explore their thoughts, no, explore their emotions. So example, no, of the way we question our client is with the use of no, what, how, or does. No, as example here, what is happening with your body right now as you speak about your isolation? Or how do you experience the fear of rejection in this group? In questioning, we do not ask why questions, because in why questions, we are asking for an explanation. In counseling, we do not seek for explanation, but we merely ask because we want our client to explore what their thoughts are, what their emotions are, that most of the time it's unexpressed. Okay, then we have linking. So linking is all about highlighting no shared experiences among members to enhance connection and reduce isolation. So one examples no here is, does anyone else in the group feel connected no, to what Catherine is saying, or who else is affected by the interchange between Pamela and Catherine? Are you willing to tell them now how you are affected? So it's all about making use of the sharing of one member and trying to link it with the other group members, as other members might be experiencing the same, or there might be similarity of experiences. So we are not treating one concern or issue in isolation, but we are trying to open it up, explore it no, with the other members that may have similar issues. And then we have confronting. No, when we confront no, the group members, of course, we make sure that we do it in a respectful and constructive manner. So when do we need to confront? No, when there is a behavior of group members that is disruptive by nature, especially if it influence or affect no, the group functioning. So example, no, you will say, Danny, rather than telling her that she should speak up, are you willing to let her know how her silence affects you? Or will you tell her why it is important to you that she speaks? Because um, in confrontation, we are able to promote accountability and growth. So we point out a certain behavior or action of a group member, and um, what that action tells about the person, because Danny might be unaware that demanding others no, to share when they are in silent no, might have an issue on the part of that member that needs to be explored. Then we have supporting. Supporting is offering encouragement and reassurance no, during vulnerable moments, so especially during crisis or changes. So the very purpose in this skill no, is to reinforce member to be confident and resilient. So example, no, you showed great courage sharing that today. Or for example, if a client no, or a member will initiate to share challenging experiences in the past. Um, that is, we give support by reaffirming that the struggle. Now, for example, um, it's so courageous of you to open up that matter in the group. So um, the member will be feeling um, supported, knowing that um, experiencing such struggle no might be difficult to most no, to open up, especially in a group that there is a risk no, of um, being misinterpreted. Then we have blocking. Blocking is to not to interrupt counterproductive behaviors like sarcasm, storytelling, or side conversation. So, the very purpose of blocking is to maintain group focus and safety. So, example, no, as a group leader, you will say, let's pause here. Mark, I notice you keep shifting the discussion. Can we stay with what you initially brought up? Because there are tendencies now for a client if they are experiencing already anxiety or uncomfortable emotions, they tend to shift from one topic to another and would somehow influence the group to be lost of focus. So as a counselor, we need to stop that way of storytelling maybe or unnecessary conversation while there is the sharing to refocus the group and the client also who is sharing a certain concern. Then we have assessing. So in assessing is our ability to evaluate behaviors and um, somehow identify the needs of that member to be given, to be guided with an appropriate intervention. So the very purpose of assessing is to help group members decide when to dig deeper or when to protect the client from the feeling of being overwhelmed. So for example, if a member expresses a feeling of rage, the group leader assesses if it's safe and helpful to explore the emotion further or um, just somehow temporarily not to discuss it further because it might cause it further harm to the member who is sharing. So um, in this skill it's very important that as a leader we are able to um, give proper assessment because if we are not aware of the worst case scenario that we cannot somehow handle the possibility of the inappropriateness of responses. So for example, if a client is manifesting a behavior that is let's just say weeping a lot when that member shares a very painful experience. No hatred, maybe, or rage from a father who um, is abusive. So it's our um, capacity as a counselor to somehow weigh whether it's appropriate to delve the topic further. Is it bearable for the client to go it further, or we just tend to let the client or the member calm down so that um, the member who is sharing will have the opportunity to be in touch with the emotion rather than keep on digging the issue and we don't have no the assurance that it can be managed by the client because it might pose at no self-harm or it could be already overwhelming for the client who is sharing and can be overwhelming to other group members. Then we have modeling. So in modeling as a leader we will demonstrate ourselves the behavior that no we value, especially in facilitating a group, such as being open, being honest, and also um, showing that we also have vulnerability. So we do not just demand these desirable qualities from our group members, but as a leader, we need to model it. We need to set the tone and encourage imitation. So example in modeling, a leader shares a brief struggle to model emotional transparency. So if you are leading members to share their biggest mistake, it's good that you share first so that the feeling of being uncertain, the feeling of being anxious, it um, will slow down knowing that as a leader you model You shared first. No, you set the tone first. That even the most uncomfortable conversation, you model the behavior. Then next we have suggesting. Suggesting is offering ideas or experiments, no, perspectives or tasks to help members shift or reflect. Example, no, as a counselor, whether facilitating an individual counseling or group counseling, again we do not advise, no, unless otherwise, no, it's a very we are handling crisis intervention, crisis situations that it needs, no, requires us to be directive. But in counseling, um, we give suggestions in a manner that um, the client still, the members still have the last say, whether they are comfortable doing the task or not. So, example, as a counselor, we will say, you might try writing a letter to express, what you can say aloud. Or you will say, would it help to role play that conversation here? So, you are trying to offer ideas. How can they um, put into action, what they can't express? Then 16, we have initiating. So in initiating, it's about helping group members to start new processes. So that is only to focus on their personal goal. Example, as a counselor, you will say, who would like to begin the sharing today? Or you will say, let's take a few minutes to check in how our week has been. Okay, so that is initiating. Then next we have evaluating. So, evaluating is reviewing the group's processes and outcomes. Now, the very purpose of evaluating is to track changes and informs future sessions. So, for example, as a counselor, no, you will say what changes are resulting from the group, or what are the therapeutic and non-therapeutic forces in the group. Or you may say, have your goals shifted since we started? Or what are your takeaways from today's sessions? Okay, then we have terminating. So terminating, that is being able to manage, how to end the group session or the group itself. So the purpose of managing how to end the group is to ensure closure, affirms progress, and prevents abrupt, disengagement. So, example, in the termination uh, stage, the counselor will say, as this is our final session, what are the things that you are most proud of? Or what concerns do you have about life after the group ends? These counseling skills, are not merely techniques, but they are also relational tools that reflect the counselor's presence, ethical standards, and therapeutic intentions. So, mastery of these skills would somehow emphasize a safe space where members can grow, explore vulnerabilities, and build new insights. Can be individually or collectively. Co-leadership, no, as we have discussed in the previous session, it's all about having, more than one leader or therapist or counselor handling or managing the group. So here are some of the mistakes, in co-leadership that will hamper, the effective group process. First is not sitting across from one another or making continuous eye, not being able to make eye to eye contact, with their co-leader. So this mistake, would somehow create a visual and psychological um, disconnection that will signal disunity to the group. Example, if a co-leader, avoid eye to eye contact with group members, or it could be the co-leader himself or herself, it might signal a message to group members, that there is tension or division, which reduces the perceived safety of the group space. Then we have second, no, the failure to share goals or plans. There is um, no proper communication. So this mistake, no, could be that one leader forms a plan but does not communicate. So the tendency, no, it will lead to being inconsistent. No, the group members might experience confusion, though because they observe, no, that there are inconsistent messages from the different leaders, and it will also reduce trust among group members. So example, one leader may initiate a trust building exercise while the other is unaware, resulting in misaligned facilitation. So it's very important that before the session will start, the co-leaders need to be meeting, no, having a briefing of what are the expected, no, what are their goal for that session, what are their goals for that session, so that um, they will have aligned, no, plans and objectives all throughout the session. Then we have the third being, no, competitive with our co-leader. So this is not trying to outperform or dominate the co-leader. So it has the tendency that members themselves feel pressured, no, to choose or to choose sides, no, which fragments group unity. Dahil mga factions. So example, for being competitive or there is a power struggle is um, interrupting or correcting the co-leader in front of the group members, which can somehow humiliate, no, and model poor relational behavior, because as a leader we need to model, no, constructive and productive behavior in the group. Then another mistake is overcorrecting or seeking validation. In this mistake, no, one leader might be always wanting to be right. That is, that would somehow result to reduced collaboration and increase friction. So example of such is correcting small errors from a co-leader just to assert authority, no, distracting from the group's purpose. Then another mistake here is alternating roles, no, versus true co-facilitation. So taking turns instead of integrating leadership styles will result to the members, no, experience inconsistency, as each leader's style may feel disconnected. One leader may handle, no, example, one leader may handle the logistics while other leader always addresses emotional issues. So that is creating silos that um, one leader might be disengaged with the process while the other one is over engaged. That could also result to emotional burnout. And um, another mistake is also unequal participation. One co-leader remains passive, no, that would somehow create an imbalance, no, that will overburden one leader and would somehow reduce collaborative energy. So example is the more active co-leader may become fatigued while the group begins to ignore the quiet leader entirely. Then we have the advantages of co-leaders, no, co-leadership. If it has its disadvantages, it also has the advantages. So first is diverse role models. When leaders vary in gender, for example, or personality, or the way they communicate, they model inclusivity and flexibility. So, for example, a male and female co leaders may better relate to different members now, that they are able to establish broader group identification. Then we have enhanced observation and feedback. in which two leaders can notice more dynamics in the room and provide richer feedback. Because um, when there are two leaders, if there are nonverbal cues that group members may exhibit, no, if one leader may not be able to observe it, the other leader, no, has the tendency to observe such. So that's why it is somehow noted as one of the advantages. And of course, um, transference, no, managing transference issues. If a group member experiences transference, no, that is reacting to a leader as if they were a parent, take note what a transference is. A transference is an emotional reaction that members, no, one member might be projecting to another member, or it could be projecting that emotional reaction to the counselor or the leader, no, that emotional reaction that has been projected stems from one's um, past experiences. So, in management of transference, the benefit of a co-leader is that the second leader can intervene. No, a co-leader can gently redirect or explore the dynamic while maintaining group continuity, as the other co-leader has been the subject of transference. Then we have real-time support and debriefing. So co-leaders, of course, can give support to each other emotionally, strategically, especially in high stakes sessions. Example, now after a heated confrontation, leaders can debrief, no, so they can evaluate, no, the interventions and emotional responses of the group members. And these are, no, the same with the disadvantages presented earlier: cross purposes, no, plans that are not communicated, conflict due to power struggle, and of course, no, especially if it involves professional fee, other co-leader might be charging higher while the other might be charging lower. That might result to conflict because again there is no close collaboration. That is why to maximize no co-leadership is to be able, no, to discuss roles, expectations, and leadership style. That is as well to use nonverbal cues to coordinate during sessions. So two leaders, no, again, before handling a group session, there should be pre-group planning so that they know what to expect, what role to portray, and of course those nonverbal cues are very important so that they would know the messages, no, being relayed while facilitating the group. And of course in the post session debriefing, co-leaders need to regularly, no, review what went well, what needs adjustment, and how members are responding. It's very important that co-leaders need to model collaboration. That is to show mutual respect, you know, active listening, and shared decision making. In a didactic group, no, this refers to a structured group typology, no, primarily focused on providing instruction. So, its key features, no, instruction-based learning, meaning in didactic groups, no, it's grounded on providing clear, targeted instructions. So example, that is to provide, no, lectures, reading assignments, and guided group discussion, no, that would somehow center group members on a predefined topics. That is to teach them no specific life skill. Then second feature is learning conditions that will somehow improve, no, their self-direction. So these groups are structured, no, to support autonomy. When I say autonomy is we are helping members to be able to decide, no, for themselves, to be in control of their choices, no, and their decisions. That is being also motivating them, no, for a self-initiated learning and personal reflection. So while the facilitator leads with content, Members or participants are encouraged to process and internalize the material in their own unique ways. And also in didactic group, it use it uses no written materials and repetition. So the learning process is reinforced through materials such as handouts, visual aids, no rehearsal techniques. So repetition, review, and generalization strategies are used to aid memory retention, no, and help members apply what they learn in real life. So example of a didactic group topics like managing your stress, personal hygiene, sleep problems and hygiene. So just like in the most of the guidance services center, we have pamphlets, we have brochures, no toolkit that even without attending a formal lecture, no, by just reading the brochure, the student will be guided, no, how to manage a certain issue, no, focusing on that specific material. So these sessions are particularly useful, no, ang didactic group very useful for rehabilitation centers, community-based health programs, especially, in schools and correctional facilities. In any group, no, didactic or otherwise, the leadership style adopted by the facilitator significantly impacts the effectiveness of group interaction, no, engagement, and outcomes. So first, we have autocratic or authoritarian style. In this leadership style, the leader makes decisions independently, offering minimal input from members. It is best used in crisis situations or when quick decisions are needed, example, managing an outburst in a therapy group, or mm, any crisis situation, like, for example, um, when the group is experiencing um, emotional distress now while experiencing, for example, earthquake. So the risk of this leadership style is being able to um, members have the tendency, to inhibit participation since they are not involved, especially, of course, there might be a feeling of resentment, no, of not being involved because this type of leadership is more of the leader himself or herself. So it's best in emergency situations, no, with this kind of leadership. Then we have the laissez-faire or the hands-off style. So the leader here adopts a passive role, no, allowing group members to direct themselves. Laissez-faire, though it has its limitations, it's also best, no, when group members are highly motivated, when they are committed, mature, no, to somehow um, achieve the goal of the group. For example, no, graduate level support groups or leadership cohorts. So the members there are working toward the same goal. The risk in the laissez-faire leadership style, no, it may result in lack of direction or uneven participation if members are not equally committed. Then we have the democratic style, in which the leader seeks and incorporates group members' input in decisions. It is best used in most group settings, no? Especially in counseling, in educational or support groups, as it tries to um, emphasize ownership and cohesion, no? The feeling of oneness. Um, it somehow encourage collaboration, no, and enhance trust among members. Then we have speculative leaders, in which a leader, no, uses charisma and vision, no, to steer the group, often without peer level input. So this type of leadership is good to use, no, to use, I mean, in motivational setting or goal setting workshop, in which also It has its risk, like it may create dependency or adoration rather than empowerment. Then we have the confrontative leadership style, in which the leader shares authentic emotional reactions that would encourage honest feedback within the group. It is good when members have um, acquired personal growth and insights, which is actually a shared goal in psychotherapy groups. So in this confrontative style as well, it must be cautioned, that it should be only used with cultural sensitivity, to avoid alienation or resistance. Confidentiality, is a very core of ethical principle in counseling. So it is designed, for us to protect our client disclosures and build trust. However, in group counseling, introduces complexities that make confidentiality more difficult, to ensure compared to individual sessions. The American School Counselor Association in 2010 asserts that school counselors must clarify um, that confidentiality cannot, be fully guaranteed in a group setting. This statement recognizes that while counselors are ethically, obligated to uphold confidentiality, they cannot control other group members' actions. It's because, as what Lasky and Riva in 2006, specified, that group members who violate another member's confidences, faces no legal consequences. Unlike in the individual counseling, that confidentiality is most likely be upheld because the counselors themselves are ethically bounded, with the regulations, in the practice. But in group counseling, just because group members face no legal consequences, they might be um, sharing information outside the group that would be, breaching the concept of confidentiality. That's why it's very challenging to really ensure these ethics, in the group practice. But as counselors, as stated in the SAA 2014, in group work, it's very important that counselors will clearly explain the importance, and parameters of confidentiality. For example, um, before the group session will start, the group counselor will have to remind the members, or even during the session from time to time, the importance of observing confidentiality, that whatever is shared in the session will stay there and they are not allowed to share it, outside the group. It's also stated, in B.1c ACA 2014, that counselors disclose information only with appropriate consent. So that's why we need to get a written consent from the group members whenever we share information, relevant with the group session. Or take note with a sound legal or ethical justification, because later there are exemptions, to confidentiality. When we say legal justification, if it's mandated by the court, no, we are bound to share only relevant information, not necessarily that we have to divulge, the very details of what the clients have shared, but only those relevant informations. When we say privileged communication, it protects clients from forced disclosure in legal context. However, this privilege can be legally overridden in the following situation. So when there is risk of harm, to self, or it could be harm to others. Second, when there is a suspected abuse of minors or the elderly, when there is a court order. Fourth, when supervision cases, are needed, and written client consent. These exceptions to confidentiality must be explicitly explained to group members before counseling begins, not to avoid confusion or misplaced trust. In psychiatric hospitals or correctional facilities, confidentiality may be further limited. Now, for example, certain behaviors must be documented in the client's file. So, example, threats of violence, disruptive conduct. Clients must be informed that their participation in the group may result in documented reports shared with relevant authorities, especially if the clients are um, the group members, for example, are required or mandated by the court not to attend the session. So therefore, as a counselor, we are also ethically bounded to submit reports pertaining to the behavioral um, anecdotes of the client within the group session. However, even if it's mandated by the court, we still have to inform the client before the session. Then, best practices, of course, as counselors, we need to clarify limits of confidentiality. Have our members sign in a group agreement or contract. We need to model appropriate boundaries and of course engage in ongoing reminders. It doesn't mean that the group members have already signed a contract about confidentiality, its parameters, its limits, its exceptionality. It's not a guarantee as well that there is a pre-group session or orientation as to the matter of confidentiality during the session in between. If the group will be engaging into sharing personal experiences that may divulge um, painful experiences, we need to remind the group from time to time the importance of confidentiality. Group counseling provides a very rich platform for personal growth, especially insight. However, as Gerald Corey in 2012 emphasized that all meaningful learning in life involves taking some kind of risk. So this statement reflects the inescapable the truth that the group will somehow experience. Though while therapeutic, no, it can also have its psychological vulnerabilities. As defined here, risk is referring to life changes that causes disruption, hostile and destructive confrontation, scapegoating, harmful socializing among members. So later, this concept of scapegoating, harmful socializing among members will be tackled in the maintenance roles. So it's very important as counselor to guard the potential negative outcomes in the session. When we say disruption of life patterns, that is um, facing unresolved trauma, or when we say hostile or destructive confrontations, that would somehow refer to emotionally stimulating sessions. When we say scapegoating, that's the tendency of one group member to blame from time to time another member. And when they say misuse of disclosure, that is using personal sharing later against the member. So in harmful socializing, a member shares a painful story of abuse, for example. Another member later trivializes that disclosure, leaving the first member feeling invalidated and re-traumatized. Okay, so these are the possible risk, psychological risk in a therapeutic groups, misuse of power, using misuse of self-disclosure, and the possibility, of um, the group member to be inappropriately sharing what has been discussed no, during the session. Scapegoating may occur, and confrontation no, can be misused, no, especially when it is done in a destructive manner. To reduce unnecessary risk, group counselors should first know members' limits, that is to avoid pushing a member to disclose before they are ready. So we need to ensure that members no, are comfortable already to share, that we make sure they are not being pressured or forced no, to take their turn. Then we have respect members' request, that is to honor when a member asks not to skip a turn during check-in. So for example, during rounds, if members are given the opportunity to individually share know how their weekends um, have been. If one member will request, can I skip this session? Can I skip my turn in sharing because I'm not ready? As a leader, we need to respect no, the request. And maybe in the next session or later in the session, the member will be able to share already. And as a leader, we also have to use no, an invitational style. That is to use gentle prompts rather than demands to encourage participation. So rather than a requirement, um, we make sure no, that we encourage participation in a manner that they will not be somehow limited no, by the time just because they are being pushed to speak up. Then avoid abrasive confrontation, that is to challenge respectfully, no, not with sarcasm or aggression. We also have to describe behavior, not character. Example, I noticed you looked away rather than saying you are being dishonest. No, and we need to present hunches in a tentative way. Example, I wonder if you felt left out rather than you say you felt excluded, didn't you? Confidentiality with handling minors now become more complex, knowing that as counselors, no, we have the ethical and the legal responsibility no, to both the client, who is the minor, and the guardian, no, the parents or caregiver. So counselors must carefully balance no, that the minor's right to privacy with the guardian's legal rights no, and the counselor's duty to protect no, are being um, put into practice. First is um, we need to respect no, the minor's need for psychological safety. That minors, just like adults, they require the psychological safety of knowing they will be treated respectfully and fairly. So counselors must build trust no, by showing empathy and creating a non-judgmental space. So example, a teenager opening up about peer pressure and anxiety will not only feel secure to disclose personal matters if assured that their disclosures no, will not be shared indiscriminately. We also have to be careful no, with how we communicate with teachers and administrators. We need to exercise no, discretion and clarity when talking to school personnel about a student. So only again relevant information should be shared no? And confidential matters should remain protected unless disclosure is ethically or legally justified. Example of which is there is a threat of harm. So when a school counselor is asked by a teacher about what a student's behavior, so the counselor might say, yes, we are providing support for the student instead of sharing specific disclosure no, made by the student in a session. Then we have to obtain no, informed written consent from parents. So before counseling session begins, written permission should be obtained from the parents or guardians. No, that is to outline the purpose of the counseling session, the limits of confidentiality, and situations where disclosures are necessary. Example, if there is an abuse, just like those that were specified, no, a while ago, like if there is a harm to self and others, when there is an abuse by elders, or it is mandated by the court. No, these are some of the exceptions. So mm, a consent form should clearly explain, no, that um, discussions remain private. However, threats to life or safety will be reported. And we also have to discuss information with the minor and parents. So counselors should clarify, what kind of information may be shared and how much, the child will be informed about the sharing process. So in some cases, um, there's a joint meeting, with the minor and the parent, will be beneficial. So, for example, after a series of sessions, now the counselor may meet with both the parent and the child to discuss progress while avoiding relief. No, while discussing with the parent and the child the progress of the session, as a counselor, we also have to avoid, no, to reveal personal disclosure, and unless, of course, agreed upon by the client. We also have to empower the minor clients. No, first is we need to teach them about confidentiality. We need to educate them, know what stays confidential, what must be reported, their rights as participants in the counseling process. For example, a counselor might explain to a student, everything we talk about stays here unless you tell me something that makes me think you or someone else might get hurt. And we also have to reinforce confidentiality throughout the process. As I've said, again, na, we need to remind group members, especially young clients, no, should be reminded periodically about the confidentiality agreement, no, because there are tendencies of our clients, no, to forget the very essence of confidentiality. So you might be, as a counselor, at the beginning of each group session, you will remind them, for example, let's respect each other's stories. What's shared here stays here. So I'll be presenting again now for retention, the exceptions to confidentiality. First is we need to clarify the limits in the written statements. So before any counseling begins, counselors are required to provide a written statement that is outlining the limits of confidentiality. So this is part of informed consent, no? To ensure clients understand when and why confidentiality may be breached. Example, a group counseling orientation document may include, no, a clause stating that if a client shares intentions to harm oneself or others, the counselor is mandated to report it. Then, second, counselors have the legal duty to report threats of harm. So, counselors are legally, not just ethically, we are legally required to report any credible threats made by a client to harm themselves. It could be suicidal ideation or plan, or it could be ideation or plans to harm others. So, for example, in the session, if a teenage client discloses to the counselor or within the group session, "No, I've been planning to overdose this weekend," the counselor must take immediate, no? Dili ugma-ugmaon, dili unya-unyaon. They must take immediate protective action such as contacting the parents or caregivers, contacting a psychiatrist or emergency services. that as counselors we are mandated, no, to report, no, not just harm of oneself and others, but report any form of abuse. It could be child abuse, child molestation, incest, elder abuse, or abuse of dependent or disabled adults. So because failure to report these, no, can result to legal consequences for the counselor and can increase, no, risk to the victim. So it's very important that as counselors, we need to know our duty when to report. And of course, when there is an imminent threat to others, if a group member credibly threatens to seriously injure, no, another person, we need to consult with supervisors or senior colleagues, our mentors, especially if this will be encountered, no, for counselors if they do not if they are not sure what to do, because we need to warn the intended victim. So giving a warning to the intended victim should be done appropriately under, no, our um, under the assistance or support from the local government. Now, this is what we call the Tarasov principle, in which a student shared that um, he or she wants to kill, no, his or her teacher, no, Tiatara Tarasov, but it was not proactively acted out by the one being informed, thus result to the death of his or her teacher. So that's why whenever someone will report or share that they have the tendency, you know, to harm other people, we need to warn the victim himself or herself. Of course, we need to notify authorities such as police, no, if a blatter or mental health crisis team. Example, a client angrily declares, no, if my ex shows up again, I swear I'll stab him. So this statement must not be dismissed and should be documented and acted upon with urgency so that the person will have the knowledge, no, the target victim will have a knowledge and can protect, no, himself or herself. And of course, when the client exhibit, when we say bizarre behavior, atypical behavior, you know, especially requiring hospitalization, like for example psychotic behavior is actions or manifestations that are not based to reality, na, like hallucination, seeing or hearing something that's not there, or delusion, no, a strong belief, no, that is not based to reality. So it's very important as counselors to arrange, no, immediate evaluation by a psychiatrist or emergency hospitalization. Most of the time, no, it's involuntary on the side of the client. It depends, of course, on the severity of the factors. So example, a client claims that they're no the client claims, for example, she is or he is receiving voices instructing him to purify the group. So this kind of delusion signals, no, a possible psychiatry emergency, because it's already not within the normal range of thinking. Then, of course, we have to um, know, no, the law, because um, ignorance, no, excuses no one. So um, we need to be equipped as to um, what will be the ethical and the legal imperative, no, with these exceptions of confidentiality. So, in cases now that a client is being required, for example, by a correctional facility, kay probation siya or parolee, so part of the court requirements is to require the client not to be attending group session. So um, as counselors, no, we must stay updated no, on our legal obligations. We need to know the established protocols for consultation and reporting. So, um, while confidentiality is very important in counseling group sessions, we need to also prepare no, our clients early about the exceptions. That is to document every step taken when confidentiality is breached. Because, again, the counselor has the obligation to report no, what the progress of the client no, to the authorized um, personnel handling the probation program, for example. So, of course, we need to inform the client whenever we are recording no, or reporting information. So there are issues not tackled in a group counseling session that's quiet to personal that would somehow involve no religious belief or views, spirituality, sexuality, or family structures. So they are often emotionally charged or stimulating that would somehow create tension or discomfort. So if they are not handled objectively, of course, it might posit no psychological risk among group members. So it's very important. No, as leaders, we need to no, we need to be aware that our own values should not be imposed no to our client. Take note that it is not our role no, as a leader to convert members to their beliefs, but rather to assist them in making choices no, congruent with their value system. So that's why I had it no, in red for us to emphasize that we need to be aware from time to time of our own biases, our standards, our morals, no, not to make sure not to impose it to our clients. For example, no, the best practice for this one is a leader will ask, how does your upbringing shape the way you see your current family conflict, rather than um, result resulting into criticizing or advice giving if a certain situation will be in conflict of your own values, and to remain no objective in the influence in order to manage well again the influence of our personal values, because we cannot our values, our personal values no, we carry with it as we engage in the session, but we should remain objective in our facilitation, and we need to seek consultation no, or supervision when value conflicts arise. So for example, if your value is not into no agreeing with how LGBTQ um, perceived no conflict. So we make sure that as counselors, no, we remain supportive and non-judgmental, so that we'll be able to um, guide our clients' orientation or identity. Take note as well, no, we need to avoid stereotyping or making assumptions based on our religious background. Especially no, religious background is very quite sensitive, as we might disagree for many things, but as counselors again, our role is not to convert no with their religious perspective. So it's very important for leaders no to reflect on their current behaviors, so that it will be aligned no with um, the goal no to explore the members behaviors and their goals, not our own. So for example no, You've said that honesty is important to you, yet you also mentioned avoiding tough conversation, no, with your partner. Can we explore that contradiction? So this encourage no internal consistency and would somehow um, empower members to refine behavior with feedback no, from others. But of course, we still have to respect no, their belief system. And of course, we have to respect autonomy. No, that is letting the group members retain the responsibility to make their decisions. We will not decide for them. Our task as a leader is to help them develop critical thinking, no, and introspection, not to prescribe, no, what path to choose. Because at the end of the day, if we are to decide for the client, we are actually just forming them to be dependent rather than self-directed individual. So the concept of social justice now in group work, according to Chang and BMAC in 2012, um, for them, the social justice is rooted in the idea that all individuals and groups should receive fair treatment and equitable access. No, walay gipili in terms of benefits, resources, and opportunities. So, in practice, this means that counselors must be aware of power dynamics, no, like systemic oppression, and of course the cultural context of the client. So for example, no, in a group counseling session discussing school performance must be considered, no, in terms of their socio-economic disparities that somehow would affect, no, their academic experiences. Chang and BMAC as well no emphasize that courage is a cornerstone to multicultural social justice work. So when we say um, having that courage is being able to face no uncomfortable truth such as sarcasm, privilege, or discrimination, or standing up against injustice, or it could be engaging in critical dialogue. Example, a counselor facilitating a support group for LGBTQ plus youth in a conservative community may need courage to address discriminatory remarks, no, while upholding group safety and inclusion. So, um, when we say courageous conversations, na, that will include speaking their truth without fear, and we encourage members to speak their truth. We support respectful disagreements, no, because it can promote critical thinking. And of course, we explore barriers like poverty, racism, no, in a collaborative, safe space. So while techniques, of course, no, can enhance group process, their misuse can cause harm. So it can undermine trust and can hinder therapeutic progress. So rational, it's very important that as group counselor, no, we need to be guided of the clear purpose, no, of every technique that we are going to use in the session. We need to assess whether the technique is appropriate, no, for the developmental stage, because it might be the group counselor wants to employ the technique in the group session because he or she finds it engaging and um, emotionally stimulating, without considering that it's just the first session of the group, so it's not appropriate with the group developmental stage. So it's very important that we make use of a technique. It should be fitting, no, appropriate for the group developmental stage. Later you would know what are the different stages of group development, and of course, with the individual readiness. We need to match the technique, no, to the concern or issue at hand, rather than using it, for its novelty or just our personal preference. For example, a role play exercise can be powerful for helping a member rehearse assertiveness, but should only be introduced when the when the group climate is safe and supportive enough. So if it is just a first meeting, it might be inappropriate because there are still no apprehensions, just because they still have to know each other. And of course, we need to use that technique in a timely manner and in a sensitive manner, because now the emotional state of the group matters, especially the sequence of intervention. Some techniques require foundation work before implementation. Like example na, a cathartic empty chair technique may be too intense during early sessions when trust is still fragile. So later you would know what an empty chair is. So when facilitators or counselors use techniques that they haven't mastered, they risk losing control of the process or failing to manage emotional reactions, because unfamiliarity can lead to confusion or shallow processing or even emotional harm. Example, a new counselor using psychodrama without training, no, may unintentionally re-traumatize a member. Or it could be using technique in a mechanical way. When we say mechanical use, that refers to applying techniques rigidly or in a formula manner without adapting group dynamics or context. This can feel artificial, or members will be forced to engage, somehow reducing its authenticity. And of course, using techniques not to serve the leader's agenda or enhance their power. We must avoid using techniques not to validate our personal beliefs, or just because we want to gain control or we want to appear authoritative. Such misuse, of course, will violate ethical principles, which ethical principle, I mean, which can lead to exploitation and manipulation. Like, if a leader uses self-disclosure techniques to promote a personal ideology rather than facilitate members group. And lastly, we must not use specific technique to pressure members. It's very important to um, work in an invitational manner, as I've said earlier, rather than coercive. Because if a counselor insists that a silent member must share a painful memory, it can result to emotional shutdown. So the competence now of group leaders is multifaceted. It requires theoretical grounding. You need to have practical skills, reflective awareness, and a commitment to continuous development. So first we have here, training in group process is not enough. Well, of course, it's a basic academic or introductory training. A foundational knowledge, it is insufficient. We need to possess a clear theoretical framework to ground or anchor our decisions and interventions. We need to have a well defined therapeutic rationale behind the use of every technique, not just because it's our personal preference or we want to gain control, as I've explained earlier. No, we need to have direct experience with techniques, before applying them. So, for example, a counselor no, who has only read about psychodrama should not implement it in a group setting without first undergoing the training, no, supervision, and direct participation and techniques. According to Corey, it's not enough that we have our license. It's not enough that we earn the degree. We also have um, to be engaged, no, in experiential manner as a group member and as a leader. Now, if you are a master's degree, enrolling in MAGC or MAGC, ideally you should be involved, no, in at least 10 hours 10 academic hours in group process as a member and as a leader. Observing no seasoned practitioners and receiving constructive feedback will help prevent, of course, misuse of intervention. So, for example, if a new group counselor facilitates a group, no, a support group, specifically grief support group, may initially struggle with managing silence or emotional outbursts. Under supervision, that novice or new counselor no will somehow learn how to sit with silence, how to validate feelings, no, and use reflective techniques. Appropriate, of course, in redirecting um, prematurely or becoming overly directive. Then, of course, specialized training in group therapy workshops is highly encouraged, as it can, of course, no, be very immersive by nature. Like, for example, managing challenging group dynamics, no, that is to focus on resistance and conflict, no, and understanding stages of group development, like forming, storming, norming, performing, and adjoining, which will be tackled in detail no, in the later presentation. According to the Association now for Specialists in Group Work or ASGW, take note again, ASGW no, is a division of ACA, American Counseling Association, responsible in publishing ethical and professional standards in the practice of the profession. So it states no, in ASGW no, that professionals should be aware of their competencies. And when those are exceeded, they should seek consultation from qualified professionals. So do not be ashamed to seek supervision from senior colleagues because um, it is actually no being mandated as part of our code of ethics not to be feeling the superhero because it's not again a guarantee that we have the license. We can already proficiently no overnight perform as seasoned counselors have done in the past. And of course no the American personnel and no the AGPA, American um, Psychotherapy Group Association, stresses that professional competence no, is an ongoing developmental process. This implies that competency is not a fixed achievement but an evolving journey. So that's why when you have your license soon, no, it's just a start of the journey. You have to, from time to time, attend conferences to be no, updated with the current issues and trends in the practice of our profession. And as competent counselors, no, or leaders, we must remain, of course, no, in the current developments. That's continuing education, ongoing supervision, or participation, of course, in professional development activities. Take note again, no, gibalik-balik na ni siya, it is our ethical no, mandate to uphold confidentiality and make sure again not to restrict our practice to populations for which we are trained, educated, and experienced. Di ta magpaluma-luma og manage or group sessions when we are not trained for it, no, because again, we are just no, a generic practitioner. If we have our license, we need to pursue specialized training of a certain approach or technique for us to be able to successfully um, apply it, no, to our clients. So example, no, a school counselor with no formal training in addiction therapy should not facilitate a substance abuse recovery group, even with good intentions. Because working beyond our scope of competence, no, may do more harm than good and may result in legal and ethical violations. So we need to be mindful of that. And of course, we need to be alert, no, for symptoms of psychological, no, debilitation and refer when necessary. Referring a client to a more competent professional, no, is a good practice whenever we assess that we are no longer capable, no, of handling the client, or it's no longer healthy, no, for us to handle the client. No, we need to be aware of the red flags. Example, suicidal ideation, aggressive outburst, extreme dissociation, no, from the reality. A member might be in a trauma recovery group, begins exhibiting signs of PTSD or flashbacks, no, and expresses an inability to function outside the group. So this may indicate the need for individual therapy or psychiatric intervention. So, as counselors, we need to respectfully recommend a referral and help connect the member to appropriate resources. No, di na to ipamugos that that member will be part of the group session knowing there is a bizarre or atypical behavior exhibited. Then, of course, no, we need to avoid making unrealistic promises. It is unethical for us to guarantee results such as you'll be healed in 6 weeks or this group will fix your depression. So, professional boundaries, no, counselors should communicate that the outcomes of the group counseling depend on member participation or openness. Instead of promising, no, that leaders should guide members to recognize, no, their um, growth. For example, no, the leader will say, um, your growth here will depend on how much you are willing to explore and engage, rather than making, no, giving false reassurance. So, in the study, of course, of social structures and group dynamics, we need to also know how to classify groups into primary and secondary categories, as it will help us understand, the depth, the purpose, and the function of human interaction. So, first, we have here the primary group. So, most likely, primary groups are small, close knit social units where members interact on a face to face basis. There is a strong emotional ties, like, of course, family members, partnership, or study group. So, in terms of resolution of personal issues in the primary group, they discuss most of the time sensitive and personal matters like friendship, close friendships, they tend to share secrets, or they share something personal to them, like intimate relationships. And of course, there is homogeneity in primary group, like they share common backgrounds or values or norms. And take note again, in primary group, there is a sense of belonging and loyalty, is very strong. Um, Personal gain is secondary to group welfare. For example, in a family setting, which is considered a primary group, members do not just perform roles, they share a commitment, no, to each other's well-being. They look after each other, they support each other. If one member is in distress, others step in, not out of obligation but out of love and mutual responsibility. While the secondary group, no, is more functional and goal oriented. So if the primary group is more on emotional closeness, the secondary group is more goal oriented. So in this group, it's more larger, more impersonal. So if primary group is a personal, no, manner of relationship, no, there is that closeness, the opposite of which is the secondary, which is more impersonal or transactional by nature. Like for example, no, relationships in the secondary groups are defined by rules and responsibilities rather than deep personal connection. Example, lecture halls, work committees, professional organizations, class projects. So there are deliverables that they need to deliver at the end of the session or in a certain time period. So the manner of interaction is more transactional because they are gearing towards a certain goal. So members here assume defined roles such as chairperson, secretary. So rules, protocols here are often governed, they are formally assigned or designated. So example in the secondary group, in a committee organizing a school event, na, which is a secondary group organizing committee, the members collaborate to assign tasks, manage logistics. No, emotional ties are not their primary motivator, but the effectiveness and the efficiency, no, on how they achieve their desired goal. We also have informal groups and formal groups. So when we say informal groups, no, it is rooted in social connection and personal fulfillment. So most likely informal groups are primary groups. No? These groups are spontaneous, naturally occurring collections of individuals who come together, of course, based on shared interest, friendship. Now, these are actually examples of primary group, no? Friendships, personal relationships, rather than assigned, no? Or social fulfilling social needs in an assigned goal. So, informal group is under the primary group. So, the purpose of informal groups, no, is to fulfill personal needs such as belongingness, companionship, and acceptance. So, example, co-workers who most of the time, no, will have lunch out together. So if there are, for example, in the College of Education 60 faculty members, but in the day-to-day routine, no, only 5 members are getting along together most of the time, going out. Another set of circles will have their own interest and they have different activities. Those small circles, no, are actually informal groups, no, that they relate with each other, not transactional by nature, but somehow fulfilling the personal needs of belongingness, companionship, or acceptance. So illustrative example. Now, in a corporate setting, employees from different departments may form a weekend hiking club. So, while this group does not directly contribute to organizational goals, it builds camaraderie, no? And may indirectly enhance teamwork at work. So, if the group members are gathered together not to fulfill a certain goal or task, they voluntarily go together as a group because they are being reinforced psychologically with a sense of we-ness or belongingness. Now, they like the companionship or there is a sense of acceptance. It can boost their morale. So that is an under informal groups. While for the formal groups, from the word formal, it's transactional by nature. So therefore, it is under the secondary group. Example, no, there are hierarchies or roles and responsibilities. So the leadership here is designated like a supervisors. No, members are held responsible for their performance. Example, project teams, committees. So they are into productivity, no, decision making. Like for example, no, in a university, they may establish a curriculum review committee composed of faculty members. So this group is formally tasked with reviewing academic programs. They are formed, they are established to deliver a task, to achieve a goal, not just for personal preference of, no, gaining acceptance and having that feeling of winness. Then we also have now the psyche group versus social groups. So when we say when we say no psyche group, no, these are informal social structures, no, primarily meet psychological needs. So therefore, psyche group is under the primary group, and it is also considered as an informal group. No, membership is voluntary. Like, for example, individuals choose to be part of the group based on their preference. Of course, their structure is informal. No rules are, of course, no rules are not clearly defined. It lacks formality. They share, no, they have homogeneity. They have similarities in terms of age, maybe, or it could be interests. They need not to have explicit tasks to achieve or measurable output. No, most of the time they are together because of bonding. No, most of the time their goals are implicit. So the very purpose of the psyche group is to satisfy emotional needs. No, the same goes with the informal groups. No, it's more on identity formation. So example of psyche groups, no, cliques, no, among adolescents who spend together time after school, or it could be gangs, no, in which they provide a sense of family and protection. Mga um, sorority, no, fraternity. So those are part of the psyche group. So then we have the social group, which is task oriented and goal driven. So social group is under the formal group. Okay, sorry, I wasn't able to transition my presentation. So, in social group, of course, it is structured by nature, roles are assigned. There is heterogeneity of members in which they can be assigned as a group, gathered together as a group, but they may differ in age. They may differ in profession or specialization just because they are gathered together and they're expected to deliver certain tasks. So, example of a social group, no? School dropout prevention committee or community development board or crisis intervention team. So basically, no, going back, primary groups, informal groups, psyche groups, no, they are under one category. Formal groups, we have secondary groups, formal groups, and social groups. Then we also have the closed versus continuous groups. When we say continuous, it can also termed as in other text open group. So it's very easy to remember because in closed group, of course, it's exclusive. The original members who joined in at the beginning, no, should be the same group members, no, who will be all throughout the session. So it is fixed in terms of membership, of course, because their membership is fixed, the higher the potential no, for trust and feeling of unity. While, of course, the disadvantage if members will drop out, as I've said in the previous session, and it may suffer from reduced diversity. No, magkagamay siya. While in the continuous open group, no, It allows new participants to join in at any point. So there is flexibility in terms of membership. Members can exit or enter at no at different times. So because there is a flexible entry, members need not to wait for another new cycle to start. Kay makasulod naman sila. But of course, though na siya advantages of being accessible and dynamic in terms of environment, it's very difficult as well not to build cohesion because from time to time there are changes. So there are also two contrasting approaches no, to group dynamics. First, we have no, the individual orientation. So this emphasizes, of course, from the word individual, no, its focus is on each member's personality, no, their behavior, their contribution to the group. Like for example, um, the leader sees the group as a context for individual growth or change, or attention is given to individual goals or issues in a therapeutic progress. So it's very useful no, in therapy groups or counseling where personal development is prioritized. So for example, in a group counseling session for adolescents with anxiety, if you're applying individualistic orientation, the counselor may focus on how a specific member reacts to group pressure, no? Learns to assert themselves or overcome social fears. So progress is evaluated based on individual behavioral change, no, rather than the group cohesion. While for group orientation, no, it's the opposite of individual orientation. A single functioning unit, no, it emphasizes group process, group cohesion, the rules and the norms, no, rather than the individual interaction. So in here, no, in a psychoeducational group, for example, the facilitator tracks how the group communicates, how the group makes decisions, and how they form consensus. So the success of the intervention is measured by how well the group functions together, not just an individual progress. So group operates no when roles are clearly identified and balanced. Now the question, mom, are the roles assigned or it will just naturally um, emerged no within the session? Most of the time, task roles are assigned while maintenance roles no just naturally unfolds during or all throughout the session. So when we say task roles, no, these are behaviors and actions that directly contribute to the accomplishment of the group goals. So what are these roles? No, of course, later no, I will be discussing each of the role. While the maintenance role is focusing on relationship. So maintenance roles are also known as relational roles as it focused on interpersonal, no? Emotional concerns of the group. So what are the task roles? Again, task roles most of the time no, are assigned. There's what we call initiator. The function of that role is to suggest new ideas or solutions. Example, a student proposes a campaign for mental health awareness. So information giver, the one who provides data or relevant content. A member shares research statistics on adolescent stress. We also have here no um, opinion seeker, no asking for more qualitative type of data, no feedback. Then we have here um, opinion, no giver, the one who provides no one's perspective on a different representing different groups in the society, to give another perspective of the issue. Then we have elaborator, the one who expands, a member who explains how mindfulness maybe can be implemented in the classroom. Then we have the relationship roles or the maintenance roles. No, they are considered the social glue of the group, while ang task roles, the engines of group productivity. So maintenance roles or relationship roles, no, akong gigon ganina, they are not necessarily assigned. It will just naturally unfold throughout the session. Na ay mga encourager. Those members no who affirm appears courage in a sharing painful experience. We have the harmonizer. No, for example, the one who comes a disagreement by highlighting common ground. We also have here compromising. Example, a student negotiates between opposing opinions on project design. No? That is to resolve conflict. We also have gatekeeper, making sure no, that everyone has the chance to participate. A facilitator may invite no, a quiet member to share their thoughts. We also have standard setter. No, that is making sure that the members uphold group norms and ethical standards. That is reiterating no, what rules are being agreed, especially on confidentiality. We also have observer or commentator. That is pointing out, of course, no, the group tends to avoid difficult topics. That is to monitor no, and reflect the group process. For example, no, if there are positive or negative aspects no, of the group dynamics. Then we have the follower. Now that is to affirm decisions without actively shaping direction. So follower is simply, of course, no offers acceptance and support, no without leading. We also have individual roles. No others term it as self-centered or self-serving roles. No, or others also have it dysfunctional roles. These roles are non-productive behaviors. No, they detract the group goals. No, and somehow emerge when a member prioritizes one's needs. No, giuna ang personal agenda over the group's welfare and cohesion. So it's not always intentional. No, to be disruptive, but it can also, of course, hinder no the group progress. So we have here help seeker. No, help seeker frequently says, "I don't get it. I'm probably not good enough." Or consistently seek validation rather than contributing. So instead nga makakontribute sa grupo, pabigat na hinuon siya. Okay? So second, we have recognition seeker. No, it somehow um, seek the spotlight. No, through boasting, exaggeration, or dominating discussions to gain approval or admiration. Example: a member no repeatedly recounts personal no accolades during a group discussion on teamwork, overshadowing others' input. So, na-dominate na niya, no? Siya tanan mi istorya. Counselor's intervention here is to gently, no, confront, again, in a respectful and constructive manner to process commentary, inviting the group to reflect, no, of course, on balanced participation. Then we have here play group. Nope, not play group. Playboy or playgirl. That is demonstrating apathy, dili apathy, demonstrating na cynicism or being indifferent. No, that is avoid participation. So, iyahang um, behavioral manifestation in a group kanang magsigi og hatag og sarcastic comments no or jokes no to avoid engaging in a serious topic. Magsig bugal-bugal nya serious na kayo ang gitakol or shows physical signs of disengagement na dili interested. Example, in a school group, a student, for example, na jokes and plays on their phone during a sensitive discussion about bullying. It might create discomfort no, among peers. So therefore, as a counselor, we need to use no exploration of possible defenses, that may be masked by the behavior. Maybe that person who engaged in a playboy or playgirl role, there is a discomfort behind the action because that person might be trying to cover, no? Um, Unresolved issues. So that's why there is that defenses trying to mask it. Then we have the special interest pleader, no? Someone who always speaks from the perspective of an external group. Kanang instead of speaking up for oneself as a member, that person always speak up in behalf of a certain um, community, like for example, no, being a student leader, being a parent, so being a representative of a certain community group, no, iyahang i-cite iyahang opinion or ideas, not as a representative of the self, but trying to speak up in an outsider identities, no. And of course, counselors should be able to recenter, no, the focus of members to make sure, no, that personal reflection is linking the group back to their shared purpose rather than being carried away, to push an advocacy that may not be aligned with the group goal.